I'm Beth Allen. I am very proud to be an ambassador for the New Zealand Gynecological Cancer Foundation, an organisation devoted to helping women understand the symptoms of cancer of the reproductive organs. In New Zealand, 1 woman dies every day from a gynecological cancer. The foundation is a cause that's very dear to my heart, as both of my grandmothers died from gynecological cancer. As an ambassador, my aim is to inform as many women as possible about the symptoms of these cancers and to get you talking to each other and to your doctor. The best way to successfully treat any gynecological cancer is to identify it early. I hope you will stop for a moment and reflect on your own gynecological health. To tell you more about the 4 main types of gynecological cancers and their symptoms, here is one of New Zealand's leading gynecological oncologists, Dr. Ailing Tan. Dr. Tan is a specialist who deals with gynecological cancer patients every day.
Gynecological cancer involves cancer of the women's reproductive parts, and what I mean by that, and I might just use some of the model I've got here to illustrate, I'm talking about cancer of the ovaries. There's 2 ovaries, one on each side. Cancer of the womb, which specifically I'm talking about the lining of the womb called the endometrium. Cancer of the neck of the womb, which is the cervix, we'll call that cervical cancer. And last but not least, the vulvar cancer, which is on the external genitalia of the woman.
Dr. Ailing Tan will now sum up the most common signs and symptoms of gynecological cancer.
The symptoms of ovarian cancer are bloating, and what I mean by that is abdominal bloating, abdominal and pelvic pain, feeling full quite easily after you've eaten, and urinary symptoms, sometimes like frequency, going a lot, or feeling pressure in your bladder. Now, not all the symptoms mean you have cancer, but obviously if the symptoms persist and they're severe enough for more than 4 weeks, then you should consult your doctor. Endometrial cancer is the most common gynecological cancer, and a majority of women that have endometrial cancer are postmenopausal. Any woman who's gone through the menopause and has bleeding, that is abnormal. So that's pretty clear-cut. Now, it's in women who haven't gone through the menopause that it can be difficult, but if the periods are heavy, but they're regular, that's probably not a problem. But if they're heavy and irregular, that is not normal. Your periods should get lighter and further apart. The next cancer that I'd like to talk about is cervical cancer. And as we all know, cervical cancer has a screening program, and that has worked very successfully in New Zealand in picking up precursors of cervical cancer. This has decreased the incidence of cervical cancer in New Zealand and also decreased the death rates in New Zealand. Now, if women have cervical cancer, the symptoms are that they can have abnormal bleeding, usually after intercourse, or an abnormal smelly discharge, or sometimes pelvic pain. Vulvar cancer involves 5% of all gynecological cancers, and 90% of vulvar cancers present with itchiness around the vulva and a lump. Unfortunately, most women do not come to see the doctor because obviously it's embarrassing to go and see a doctor with an itch in the vulva, and on the other hand, some of the doctors do not examine the patient. It's very easy to pick up any abnormality if the woman gets examined.
Dr. Tan says that a woman's partner can also play a vital role in detecting vulval cancer.
It's important that partners have a look, and if they think that there's anything that's abnormal, to persuade the partners to be examined, and mainly any abnormal changes in the skin or any lumps. That's usually quite a common sign of vulvar cancer, but it can also be a sign of vulvar precursors, which are just lesions that are present, which are abnormal but not cancerous yet. So any abnormal lesions on the vulva needs to be investigated.
If cancer is diagnosed, treatment will be started as soon as possible.
There's a variety of treatments available. Usually they involve surgery, radiotherapy, chemotherapy, or a combination of all those 3. Early detection obviously increases someone's survival rates. The important message for women is that if they have symptoms and the symptoms persist, then they should seek medical advice. If they're not satisfied with the medical advice, then get a second opinion.
Gynecological cancer can affect women of all ages and walks of life. The HPV vaccine, available free to all young women, can help prevent cervical cancer, and regular smear tests can help detect early changes in cervical cells, which, if left untreated, can lead to cancer. For ovarian cancer, the BEAT acronym is a great way to remember the common symptoms. B is for bloating that is persistent and doesn't come and go. E is for eating, if you have difficulty eating and feel full more quickly. A is for abdominal and pelvic pain that you feel most days. And T is for talking to your doctor. And remember, bleeding after sex or bleeding after menopause is not normal and needs to be checked out by a doctor. And remember also that in New Zealand, on average, 1 woman dies from a gynecological cancer every day. The 4 main forms of gynecological cancer are ovarian cancer, cervical cancer, endometrial cancer, and vulval or vaginal cancer. Ovarian cancer is the 4th biggest killer of New Zealand women, with 1 woman dying every 48 hours from ovarian cancer. As a percentage of population size, there are more Māori and Pacific Island women diagnosed with gynecological cancer each year than Pākehā women. If you would like more information about the Foundation, go to our website www.nzgcf.org.nz. To talk to a cancer nurse, you can contact the Cancer Information Helpline, free phone 0800 CANCER. The New Zealand Gynecological Cancer Foundation is a non-profit organisation. You can donate to the Foundation via our website. Your valuable support is vital for us to continue to educate New Zealand women and to significantly reduce the incidence of gynecological cancer. Thank you.